It's that time of year when we urge the men in our lives to get screened for prostate cancer, okay? It can be a life-saving exam, especially for Black and Latino men. September is Prostate Cancer Awareness Month. Now, it was during one of those screenings last year when TV personality Al Roker was diagnosed with the disease. So let's break down the numbers, okay? Prostate cancer is the second leading cause of cancer death in men. About 1 in 8 men will be diagnosed with prostate cancer in his lifetime. Prostate cancer also twice as likely to develop in Black and Latino men. And here's the scariest part. Only 31% of African American men over the age of 50 have been screened for the disease. So joining us this morning is Dr. Alfred Winkler. He's the chief of urology at New York Presbyterian Methodist Hospital in Brooklyn. So good morning to you, doctor. Thank you for being here this morning.
Thank you for inviting me.
So let's start with the basics, because this is such an important topic, right? And look, guys will say, I don't want to go get screened. I don't need to. It's an embarrassing process. What is prostate cancer first and foremost, and what are the survival rates when it's detected early?
So two very, very important points. So prostate cancer is a cancer of the gland called the prostate, which has a number of functions. But the issue that we deal with prostate cancer is that there's a lot of fear among men, just in terms of being evaluated for prostate cancer. And what everyone needs to remember is that evaluation for prostate cancer really begins just with a conversation. Right. And that conversation involves a discussion of your health, your risk factors, and your family history, and deciding whether or not these statistics that we just spoke about in particular apply to you.
So look, preventative care, key. We know this. We've talked about this to surviving prostate cancer, right? And then there's the age that men should start getting screened. What is that age? Because some people say, well, I thought it was 50, I thought it was 45, I thought it was 40. And is it a yearly screening?
So that's why it's so important that this begins with a conversation, because it's different for everyone. It's different depending on your ethnicity, and it's different depending on your family history. There are folks who really don't need to consider this until their 50s. And there are folks who it's very important that you be evaluated and start to have this conversation in your 40s. So anyone who is concerned about this, first reach out to your primary care doctor, have a discussion about what your risk factors are. And it's also very important to find out what your family history is. Right. There are tons of people who don't have that awareness, and that can mean the difference in whether or not you need to be evaluated in your 40s or in your 50s.
And look, a lot of people during the pandemic didn't go to the doctor, right? They didn't go for their annual screenings that they should be, even your annual physical. So now is the time, and that's why we're talking about this. But look, there's a lot of misconceptions, too, about screenings. Some say, well, it's a little invasive, it's uncomfortable. So can you clear some of that up for us this morning?
Sure. So first, you brought up an incredibly important point, which is, during the pandemic, everyone lost access to just about everything. Yeah. But one of the most important things that we lost access to is healthcare. And a lot of those routine checkups we just missed. So now that, fortunately, because of all that we've done as New Yorkers to make our environment safe, it's important that you return to your doctor and get those checkups and have those conversations. And as a man, one of the most important conversations you should have is about your risk for prostate cancer. And again, it starts with a conversation. I think people are afraid that it automatically means a blood test or automatically means an exam. And depending on your personal history and your family history, it just may mean, hey, this is something that I need to think about in 5 years or 10 years. But it's important if you need to think about it immediately. And that's, you only learn that through a conversation.
So let me ask you this, because I think this is such an important conversation here. Why is prostate cancer more prevalent in Black and Latino men? I don't know if there's a short answer for that.
So there's a lot of research going on with this, and there certainly needs to be more. We believe that it's multifactorial. So at least in some part, it's genetic. So that's just has to do with your ancestry. In part behavioral. So as is the case with many cancers, it's a patient's behavior, in particular, your diet. Okay. So those are the two most important components that we consider.
I only have a few seconds left here, but I just want to give what is a red flag for somebody who might say, well, I need to go get screened. Is there a warning sign, something you can see, something you can feel?
So prostate cancer at its earliest has absolutely no symptoms. And that's why we want to diagnose it at this point. So I would not encourage someone to wait until they had blood in their urine,
right,
or they felt pain in their back. It's important that you're evaluated before those symptoms happen, because when those symptoms occur, it can be evidence that the cancer is already spread outside the prostate. Prostate cancer is incredibly curable when it's diagnosed, when it's localized. The survival rates are approaching 100% by 5 years if we can catch it early.
Good.
And if we can catch it early, patients have many more choices.
Early detection is everything. Cannot stress that enough, right? Dr. Winkler, thank you so much for laying it all out and really helping us raise the awareness for this very important Prostate Cancer Awareness Month.
My pleasure.
Appreciate it.
Take care.
All right, take care.